My name is Laura McMichael. I work on our performance excellence team here at Community Health Network. And I came to the network 5 years ago as a staff occupational therapist. After that, managed outpatient physical therapy and rehab for a while. And then a little over 2 years ago, joined our performance excellence team, which is just the best job in the world. So I'm a huge data nerd. I've become that way. If you know my teammates, you'll understand. It's like guilt by association. But what I think is the most important thing to consider when you're looking at data is to not treat it as data points, that you realize you're going through this process to understand how we deliver care, how our processes get outcomes for patients, and how we make sure that we know we have reliable processes. Recently, I facilitated a team to look at how often patients that come to us for total joint replacements are able to be discharged home. And that's ultimately the goal of this project, is to look at how often they go home, how often they need to go to a skilled nursing facility or acute rehab after their joint replacement. And probably about a year ago, we kicked off the project, and we were around an 18% discharge rate to skilled nursing facilities, which is higher than our competitors in the region. And the team worked together to come up with a solution to understand some of the factors that enable people to go home versus needing additional rehab. So part of my job on the team is to facilitate a pilot or a trial of the improvement and make sure that what we think are the reasons why people are discharged home versus to a skilled nursing facility are actually the right reasons. So the team decided that we should take a risk assessment that they already do in joint care coordinator camp and put that at the front end of the process, which predicts the likelihood of someone to go home or need a skilled nursing facility based on functional factors, pain level, age, gender, things like that. So part of my job then is to track these patients that have gone through the pilot, gone to the doctor's office, received the risk assessment, and then follow them through their surgery and make sure that the outcome we expect from that risk assessment is what actually happened. So I'm collecting data on a daily basis. The offices are sending me patient information. I have a spreadsheet. I enter their demographics. I enter their scores on each of the assessment questions. They have a total score, and I do a chart review to find out where they actually ended up being discharged to. So I have my lines of data. I'm filling in the cells. And I get to a line that's a cell that's missing information, and I go into the chart to find that piece of data, and I get to realize, wow, this patient, has been in the hospital a lot longer than some of the others that I've been looking at, and realize this patient had a decline in status and was actually in the ICU. And so that was really disheartening. This was somebody that the data point on the spreadsheet showed she should have been predicted to go home, and this was a really unexpected outcome of our process. And so I finished the rest of the patients I could get information on and went back about my daily work and went back to check again. I kind of do this in 2 or 3 week intervals of checking on patients when they have surgery and where they ended up discharging to. And went to that empty cell that didn't have data, looked up that medical record number, and got a warning that I was entering the chart of a deceased patient. This was an elective procedure. This was supposed to make her life better. This was supposed to improve her function and improve her quality of life. And having such an unexpected outcome just probably shocked the whole family. And the idea that they were getting the home ready, doing everything they could to make her comfortable while she was in the hospital, and never expected that that would be the last place they talked to her. It really just stopped me in my tracks and made me realize that That's not a cell. That's not missing information. That's somebody's family member. That's somebody's wife. That's someone's parent. And I'm evaluating a process and filling in data points, and in reality, they're people and they have stories. And as much as we try to analyze our processes and use statistics and use data points, that there's always going to be outliers, and that's what healthcare exists for. For the people that have unexpected issues come up during their stay, unexpected outlier needs that we need to make sure we're prepared for. So no matter how much statistics we run, there's always going to be those instances of special cause. Wow, that was unexpected. That shouldn't have happened. If you looked at our statistical expectations, or you looked at her risk assessment, she was supposed to go home. And obviously our goal in healthcare is to have reliable processes that produce positive outcomes or for patients and their families, but we have to know that we're ready to handle those outliers too. That's why it's so important that we have data that's quick, that's easy access, that is reliable, so that we can make better decisions, because that's keeping our patients safe, and that's getting them the best outcomes, and that's providing the best care at the highest value.